Hello, my friend at the EAS. Hello, all the people who have joined us for this autumn virtual meeting. I'm really honored to be part of this meeting today, and I will present to you about how to optimize our cases, our clear liner cases with outcome simulator and progress assessment software. I will explain in details how I use these features in order to make my work more easy and especially much more predicted. I want to thank all the board of the EAS for inviting me to lecture in this distinguished meeting. And I want to congratulate you for the wonderful work you're doing for our Society of Clear Liners. For those of you who do not know me, I was honored to edit until today 5 books, and I'm in the process of my 6th one, all of them about aesthetic dentistry and orthodontics. This is my website if you want to contact me later on. This is my family, my wife and my 4 kids, those of you who follow me for some years, they see that I keep growing as children do, and I'm really honored and blessed to have them around me. This is my staff in my clinic. We try to really have fun most of the day during the work. I can tell you the clear liners definitely help us to be more happy and more enthusiastic. And last week I took all of them to do some, social day together. We went to fly F-16 in a simulator and had a lot of fun. My lecture and all the simulation I'm using is actually using artificial intelligence. What is artificial intelligence? Artificial intelligence is the capacity given by human to machines in order to memorize, to gather data, and then suggest us some options of how to guide our treatment, how to forecast some movement that we are planning. And artificial intelligence also help us to visualize the future, because we want to be able to make decisions based on the prediction. Now, when you talk about artificial intelligence in clear liners, we know that companies are gathering a lot of data and they are poured into the computer. And the computer actually digests this information and give it back to you by the best suggestion for what type of movement we want to make, what the best arch expansion that is suggested to do, what is the size of the teeth, and what attachments we should use. All of it is based on the data that is gathered. So artificial intelligence concept is based on the fact that what you have today is not what you will have tomorrow, meaning that all the time we get improvement. When we use the software, when we use the data, we're actually helping ourselves to get a better suggestion from the artificial intelligence algorithm. Now, what is Outcome Simulator? Outcome Simulator actually is a tool that is integrated in our scanner. And I can bet that many of you that already have this feature in their scanner are not necessarily using it or not using it the way I'll show you today. So the idea behind it is not only marketing. I know that many people think that simulation is great because you can actually convince a patient to do the treatment when he is now on the chair and he wants to see how it's going to look. So it has a marketing side, but that's only one thing. I believe that first of all, it's for patient education, meaning that I can show the patient what type of movement we can do, and also what type of movement I don't recommend him to do. Don't forget that patients come to us usually after first or second consultation. We are probably the third one. And he was told many things that some of them are not correct, are not based on clinical data or scientific data or even biologic data. Another thing, it's a chair-side planning. The work that we do on the CleanCheck Pro, most of it can be done chair-side near the patient. You can show the patient why you recommend to do more extrusion, why you recommend to do more rotation of the molars in order to get a better occlusion. Then he can understand better what is our goal in this treatment. We can check alternative options. Many times I do 2 or 3 simulations for the same patient, one with extraction, one with IPR, and another one with anterior posterior change, for example, for surgery or for class 2 mandibular advancement treatment. I can also implement my functional and aesthetic vision. Don't forget that each one of us, each of the specialists around the world, and in each of the doctors, they have different perception on aesthetic. They have different experience on what is stable and what is not stable. So when we do the simulation, we implement what we think about this case. And this is probably the answer to those of you who say, okay, artificial intelligence actually is more clever than us because it suggests us what to do. Yes, it gives you a suggestion, but then you have to revise it and implement your input into it. And of course, the last point is the share, save, and send. And I will get more in details to this feature later on. So let's see, for example, a case which I can show you how simulation really helped me with this patient. He had 2 previous orthodontic treatments, and this treatment failed. Why they failed? Because there was no attention given to his myofunctional habits, to the tongue thrust, and to the fact that the arch had the tendency to constrict. So you see the open bite, constricted arches. You see that the previous orthodontist had placed some cribs in order to try to fight the open bite. It didn't help. The anterior incisors went up and out, and you can see here the cribs. And the patient comes to me actually 2 weeks before having an appointment for orthodontic surgery. And he asked me, okay, this is my last hope. Can we make this treatment without any surgery? So here are the x-rays, the cephalometric, and the cephalometric analysis where you can see that he has a big proclination of the upper and lower incisors and a class 2 malocclusion, skeletal 2 malocclusion. So we scan the patient like we all do, and instead of just clicking send to Invisalign and then get the plan and start working on it, I want to transfer this picture, this 3D picture, which is actually nothing but a picture, because when you scan, the scanner cannot identify where the tooth, the gingiva, or even the bone. For the scanner, it is only a picture. But we want to do what is called segmentation. Segmentation is the ability to identify tooth by tooth, gums and bone, and be able later on to move all the teeth with the gums, expand the bone, do everything we want, and to do this identification of the picture. Now, there are some programs like 3Shape Auto Analyzer where you can do the segmentation yourself and work on all this process by yourself. But this takes time and also, of course, require payments for additional software. But if you do it with ITero, like I do in my office, I do it chair-side, meaning I click, I scan, I click on automatic segmentation, and then I get my simulation. And remember, the simulation is based on an algorithm that actually gives you a suggestion what we should do. So let's look in this case. You can see on the right side this picture, so you remember how he started. And now you can see how simulation is done. So we start with the algorithm that is based on what the computer is actually giving us, meaning what type of movement the machine suggests us. You can see here that all the long axes of the teeth are marked automatically. Of course, you can stop it anytime and change it. And here you have the algorithm in the scanner give us this first suggestion of what we can do with this case. So you can see the upper and lower. You can still see the cribs on the teeth because the scan was done on the first appointment, first consultation appointment that the patient came to my office. So now, as you remember, we need to put inside our vision. And our vision is how we see this case. What is the function of the patient? Remember, he had constricted arches, tongue thrust. So we have to think about the function of this patient, aesthetics, stability, biomechanics, how I'm going to do this expansion. Do I want to do so much expansion? What will happen with so much extrusion? So I need to think about my biomechanics when I do my simulation. Habits, of course, this patient had a heavy tongue thrust. My experience. And all this now can be implemented into the simulation by the modification tool. And the modification tool is very similar to the CleanCheck Pro. The work with it is easy, is up and down, right and left, the root, the crown. We can do the same features as you do with CleanCheck Pro by Invisalign or any other clear aligner software. So we can start all this modification. For example, we want to have more extrusion because the patient has tendency for open bite. So we can explain the patient why we do it, what we want to achieve. We want to have more rotation for the molars, which the patient even was not concerned about. And all this is giving us also tools to talk with the patient about what will happen later on, how long the treatment will take, what type of, we know already that very big movements will require more time. So we are able to tell the patient now when he's chairside, not only what will be the result, but also what we think about the time of the treatment. I can also modify the shape of the arch. I can expand more. I can explain the patient why I cannot expand more than he wants, because he is a non-growing patient. He's 19 years old. And now, after I finished the modification and I have my simulation ready, I want to share my ideas. And to share my ideas, there are different groups of people that I want to share my idea with. So first of all, of course, is the patient. It can be the patient himself, his mother, his spouse, then the dental team. We want the other dental team like periodontists and implantologists and other people to review the plan and see the simulation and give us comments long before we send the case to CleanCheck Pro preparation. And this is very important because don't forget, this was done on the first appointment of the patient, long before he even paid or started the treatment. Then we want to share our ideas with a colleague, with our colleagues. It can be more orthodontists working in the office, students. And last but not least is a technician. And I will explain you what I do with this simulation and how the technician of Invisalign is involved. So you can see here the three options. One is save. And if we do here save, we can have the option to call every single simulation that we do. We have an option to call it in a different name. We have one which is stripping, one extraction, etc. When we share, we can share our plan with anyone by email and get some link with the password like you do when you share your CleanCheck Pro. And what send? Send, the button on the right side of the screen, is an option that we have every time that we do simulation to send it to Align to the cloud. Now, the technician in Align, when you will submit the case, instead of writing all your comments, please extrude this central more, please do this overcorrection in the molars, and many things that we want him to view before you get your first clean check. Then what I do my simulation, I send, and then when you submit the case, you tell the technician, please refer to iOS sim, which is mean as a simulation, and he will look for this simulation of this specific patient and will implement all the things that you did in the simulation into your clean check. So this is how patient will receive the simulation. It's very similar to the CleanCheck Pro, but there are no stages. There's no division to aligners, only before and after. But you can see the amount of stripping. Of course, if you don't want, you can hide it and play with it and get some ideas. What is your vision for his case? Now, based on the simulation, this is the first clean check and the one that I approved for this patient. Now, just think about how much time I save when I do all these things together with the simulation, send it to the technician and let him already implement everything that I planned into the clean check. Now, the algorithm of Invisalign also has a knowledge to know that if I did 4 or 5 millimeters of extrusion, what type of attachments do I need? What type of overcorrections I need? And also to fight side effects. If you do a lot of extrusion, we know that we will get intrusion in the molars. If we do expansion, we know that we may get some tilting. So immediately the algorithm, the artificial intelligence in the first clean check give you these attachments, the optimized bevel, gingival bevel attachments, which are directed in order to do the extrusion and the tilting and get a good occlusion. And this is, even if you change it later on when you do your modification in the CleanCheck Pro, it is important for you to look at these attachments, because these attachments based on artificial intelligence. And you can ask yourself why the algorithm, it's not the technician, the algorithm gave us a suggestion for these attachments. This is because we did a certain movement. So remember, this is a digital workflow. We started from scanning, and then by doing the simulation, I get already the suggestion for this clean check, which I approved. Now look at the patient, 22 aligners later, no refinement, nothing. Midline is okay. He's class 1, and arches are aligned and a good occlusion. So we save time. We save a lot of energy by having extra aligners or changing attachments, etc. So everything was very efficient because of my first simulation. Now, another tip that I can give you, which is maybe for another lecture, about active retention. What I do in this case, in retention, I create 2 palatal attachments, as you can see on teeth 11 and 21, because these teeth has a tendency for relapse, and you can see them here. Then I scan the patient and I order extra aligners in order to do more extrusion in case I will get some relapse. So the total treatment time was only 22 weeks, and I gave him some aligners with some extra extrusion in order to have some active retentions in case the teeth will want to go up. You can see another case where I use the simulation in the same manner. She is class 2, division 2, quite a difficult case. She is deep bite with the laterals proclined, also the cuspids. You can see midline deviation, 2 planes of occlusion, retruded upper maxillary incisors, and buccally inclined lateral incisors, all the typical things for class 2, division 2 malocclusion. You can see the x-rays. She's 15 years old. You can see her sept and the cephalometric analysis. She has retrusion of the upper and lower incisors and class 2 skeletal malocclusion. I use here the Invisalign mandibular advancement tool, which is integrated into the mandible. I have plenty of case. And again, this can be very nice for a future lecture for the EAS, which I think is very interesting for all of us. And again, I did simulation chairside for this patient, and this was the algorithm suggestion for this case. You can see that the algorithm maybe did a nice alignment of the upper and lower arch, but the molars are not in a good fully class 2. So I can click in the simulation on anterior posterior correction and then update my simulation and get another simulation where I can see a nice class 1, both sides. So now it's a time for me to start doing my modification with my vision, with my input, including intrusion of the upper incisors more in order to open the bite, some tilting of the lateral incisors, some extrusion of the molars, as you can see here, to get a better bite, both sides. And all this, and of course, modification of the arch. And all this was inserted into the simulation. And then I do the 3 steps: save, send, and share, which are based in all, they are standard in all my simulation. And now this again, the first clean check and the one that I approved after I sent this simulation to the technician of Invisalign. Just think how much time you save when you do all your vision inside the plan in the simulation stage instead of writing all your comments. So this was 49 aligners, 1-year treatment with all the attachments, mandibular advancement, etc. You can see the advancements of the mandible, which is with asymmetry in order to get correction of the midline. Here she is in aligner 49, after 49 aligners and nothing done, no refinement. So look at the bite, nice midline. I open the front, but unfortunately, some of the posterior occlusion has not been settled yet. You can see, which is very common in mandibular advancement treatment or twin block or any other advancement of the mandible. We still don't have a good bite in the back, not in the right side and not in the left side. And now the question is, what should we do? Where we did wrong? Do we need now, you know, my first impression is, hey, I've done mistake here. I must do steps here. What kind of steps? I can do, for example, this is a progress assessment. I will get into it soon. But what are my options now for this open bite? One, to add more buttons and elastics and get vertical elastics to the buttons and get better occlusion. I can also ask for additional aligners with extrusion attachments, which probably is what most of us will do. Maybe add some tuds, maybe do some attachments like here, you can see here, and do some extra aligners. But I've chosen to do something completely different. I've chosen to use my mentor, Wick Alexander, which one of his principles are let it cook. Remember that in your clean check, we had a very good occlusion, not only in the front, but also in the back. So here is another tip for you. I go to the final 49 aligner, to the aligner number 49. I click on export and I export STL file. This feature also exists in the new CleanCheck Pro 6 that was launched some weeks ago. Now, when you export the STL, it asks you, do you want the initial one or the final? So I exported the final one. And I printed this STL file in my 3D printer that I have in my office. And I prepare from a vacuum machine former, I prepare 2 aligners, which are made from 0.75 millimeter or 0.3 inches, which is approximately the rigidity of Invisalign, and gave the patient to wear at night. And I did some 2 fixed retainer in the front teeth, as you can see here. And this was in January 2019, both upper and lower. Now, remember, inside the aligners, there is prescription of a good bite, both upper and lower. So look what happened. I did nothing. No extra aligners, no buttons, no elastics. I just let this occlusion, which I've created in the CleanCheck and in the simulation, to become reality in the mouth. So here she is after 6 months wearing the aligners at night only, the aligners in which I had good occlusion. And look at her. I did nothing. Here is the left side and the right side, and the occlusion become really rigid and tight. So this is another tip for you for active retention. And these 2 cases demonstrate how I walked myself from the simulation to the end with some prediction that I had in my mind from day 1 when I saw the patient. Total treatment time was only 49 weeks plus 6 months of active retention. That's just to show you very quickly another case, class 2 division 2, mandibular advancement. This is a very difficult case. I will move very quickly just to show you the same concept. Here she is with the simulation that we did here, all the modification I did, as you can see in a second. This is not much work for you to do. You can go and do more extrusion, more expansion. Anything you dream like you do with the CleanCheck Pro, you can insert into this CleanCheck and this simulation. And then later on, send everything to the technician who will be able to understand what is your vision for this case. So here she is, again, 42 aligners based on the simulation. You can see soon the mandibular advancement wings coming into place. And here she is in a different angle. In another angle, we correct first the torque of the central, then we start moving the mandible, as we all know. And here she is, 42 aligners, April 2020, which was not long ago. She still has the attachments in the back, but these pictures were taken during the Corona time. Upper and lower, and a very, very nice smile. I want to finish my lecture with progress assessment. Progress assessment is another software that is implemented and integrated in the ITero scanner. And you can see this case, for example. I will not get into the plan. He's class 3. There was a big debate whether to do extraction or IPR. Again, I used the simulation in order to have more knowledge about what is the best treatment modality, and I've decided here to do stripping. Now the stripping was very very delicate because I needed to do everything very, very precise in a different stage. So I couldn't lose anchorage. You can see that some of stripping was done in aligner 1, some in 9, some in 15, some 16. So here he is coming to my office at aligner 25. And what we do usually, we'll look at the pictures, we look how the aligner fits, and we compare the plan to the pictures. And the plan and the picture look almost the same. I don't know if I can look and see any difference. But then I use this software, which is called Progress Assessment. And what this software does is compare the current situation with the clean check. And I get in colors where I am, where green is 100% of the movement that I planned actually happened. Yellow is around 10% didn't happen. And gray is no movement was detected. And purple is opposite movement was detected, meaning we lost anchorage. So look how much yellow and purple I got. And I can look at the table and see exactly what type of movement didn't happen. It's not that tooth 23 did not move at all. The extrusion and the mesialization didn't happen. So now it's time for us to look at these pictures, to look at the data, look at the table, and make some decisions about this movement that did not happen. Do I want now to continue to aligner 26 to 32? Do I want now to ask the patient to have more days for each aligner? Do I want to ask for additional aligners? Or do I need to change my biomechanics? Maybe if I lost anchorage, use more elastics, use TADs. All this is something that I need to consider when I do my plan today. And I can do for it the outcome simulator. Remember that we started the lecture with the outcome simulator because outcome simulator can help me now to explain the technician what movement I really want to do now to the rest of the treatment. So I decided to do scan for this patient, ask for 13 aligners. Remember, he had 7 to go. So it's actually plus 6 aligner from the original plan, not more. Do a little bit more stripping, a little bit changing of the attachments. And here he is after 13 aligners. Everything looks really nice, not only clinically, but also when you do the clean check progress assessment, you can see now that he is completely green. And also a aligner fit, and he is completely green, means all the movement that we have planned actually happened. So I want to thank you very much for your attendance, and I'm really here for you for any questions you will have. Thank you very much.